My name is Dr. William Tarbell. I go by Bill. I am a retired Presbyterian minister who has been active in politics and many other activities in community life. I was diagnosed with early stage prostate cancer in April of 2012. It was a bit of a shock, of course, although I had some sense that something might be going on. But my doctor and I did the necessary tests and found that I did have early stage prostate cancer. At that point, I began to investigate a variety of options. The first thing I began to reflect on is what kind of treatment I should look to and when to begin it. I consulted with an oncologist. I talked extensively with my own urologist who advised me in various ways as to which treatments I might want to follow up on. I was looking for something that would not limit me too much in my activities and would be fairly brief in duration. I heard about Reno CyberKnife on the radio. It was a radio ad that I heard several times and then eventually began to ask questions about it of my own urologist and others. My kids, of course, were deeply concerned, like other friends of mine. Anytime there's a diagnosis of cancer, it's a serious matter. And they wanted me to find the best possible way of treating it for myself. I had to make the decision, of course, as to which way I would go. I chose CyberKnife because it was accommodating to my lifestyle and my goals. At the time I went through treatment, I was working as a courtesy clerk in a Raley's grocery store here, and it's an extremely strenuous job. I didn't have one moment that I could not perform my duties there while I was in therapy. It was much like what I was told it would be, just 5 treatments in about a week's period of time without any pain or any other complications happening. All the things I normally did, I continued to do. There's one dear lady I love very much who was very concerned about the outcome of the treatment. And when I took the news home to her from Dr. Tay that I didn't need to come back for a full year because it looked so good, she heaved a huge sigh of relief and gave me the strongest, longest embrace you can imagine. It was great for her. Well, the room here, as you can see, is rather enclosed. The technology behind me here, the machine, is large and seems to be just a little overwhelming when you first lay down on the table. But it's magnificent to watch it in operation. And it's not frightening once you get used to the moves of the machine and you're listening to music. I was here during Christmas, so I got to listen to all my wonderful crooner friends sing the greatest songs in the world, you know, and relaxed. It was wonderful. If I could give an award to a doctor for his presence and his competence, I would give a major award to Dr. Tay, who is my physician in this particular treatment, and all of the staff, including most especially the technician that worked with me here in this room. Just first class. I'd like to sing a song of appreciation if I could, but I'll just simply say I would never recommend to anyone any other treatment. If they can qualify for this particular kind of therapy, they need to try CyberKnife.